is AI actually going to cure the problems of healthcare, or is it going to just make a broken system a little better?
AI absolutely has the capacity to cure the broken system in healthcare, but it needs to be deployed correctly to be able to do that.
Welcome to another episode of AI Entanglement. I am Prem Talreja, CEO of LunaGen. We produce these podcasts with the idea of exploring how AI is interacting with humans and affecting our work as well as personal lives. But AI is here to stay. It's very exciting technology, and there is a lot of future between AI and human intertwined and working together. Our guest today at this episode is Lauren Easterday. She's the founder and principal of Eastlight LLC. She's a healthcare strategy and innovation consultant. She brings deep operating experience across the healthcare system, spanning the payer, the provider, and digital health, with a focus on expansion and AI-driven transformation. So very qualified for this podcast with all of us. Lauren has led P&L responsibility for growth and large-scale client partnerships at organizations like Wipro and Clear Health, and is currently on the board of a startup early-stage company in the home cancer screening. Lauren is based in Chicago. Welcome, Lauren.
Thank you, Prem. It's great to be here with you today.
You're most welcome, Lauren. Let's jump right into our subject matter, AI and healthcare. So, just at the high end would say that, is AI actually going to cure the problems of healthcare, or is it going to just make a broken system a little better?
AI absolutely has the capacity to cure the broken system in healthcare, but it needs to be deployed correctly to be able to do that. And that needs to be done in two critical ways. One, it needs to be focused around the patient experience. So often we have segmented, bifurcated focus areas across care that create a lack of continuity and navigation for patients. We need to deploy AI clearly centered on the patient experience. And secondly, we need to focus on taking the burden off of clinicians so that they have the opportunity to do what they do best, which is provide care to people.
Well, and you touched on the hard topic or sensitive topic for me as well. I have doctors and physicians in my life, in my family, plus friends that I talk to. And really, the sad part, what I hear from them is the amount of burden they face in the healthcare system and what demands are being put on them from the system in terms of seeing more patients and having less time per patient and having to make very important decisions regarding the patient's health. And it just seems to me that area has a lot of room for helping a physician. They could, in all these areas of see less patients, spend more time, do less of note taking and less of eye contact, listening and holding hands and, all that. So have you seen instances of AI moving in that direction, and can it help?
It absolutely will be able to help reduce that burden if we really understand and deploy it correctly. And the first step to that is understanding the true burden that doctors and nurses and physicians are facing every day in their work, from moving through various systems to documentation, both pre and post appointment and in the evenings while they're trying to counsel patients and make a connection and provide care. It's a large and heavy load to bear. And so when we're making these changes, I think it's very easy for us to see quick wins and optimizations and introduce new protocols, but that's ultimately creating even more burden for those caregivers in the midst of them trying to give care. So what we need to do is take a step back and look holistically at our care delivery system and design the AI to integrate and really help those clinicians at the points that they need it. Take a change, manage approach to deploying that AI into the systems one time so we can do it in a meaningful way. Take the time with training, make sure everyone is supported through that process so that we're actually taking the load off and reducing the burden on those caregivers.
Right. I dabbled in this area with a technologist and entrepreneur who wanted to address this issue, and they wanted to build a speech to text system for the patient-doctor interaction. And we saw huge benefits in being able to reduce the burden of note-taking and all that. But there was also another interesting thing that came out of that, which was trust. The doctors themselves said that I like it, I would use it, but provided I trust it. And trust is a very interesting word because it's immeasurable. It is, if you can achieve trust across the whole healthcare system, that could be a tremendous accomplishment. So we spend a lot of time trying to figure out what trust means, how trust can be increased by authentication, lack of hallucination, all of those things that can come in with AI. And we were able to control it. But then the other challenging issue that we learned, and I'm sure you've experienced this, that's why I'm bringing it up, because you've played across the entire system from providers to payers, that one of the things that doctors told me was that the medical EMR or medical records, which were designed to help you, have now become a burden. Because it seems like everything is recorded in the EMR, the notes are going in there, so the doctors are answerable and everything, and that is taking time. So, what is your thought on that from the provider side, the healthcare system providers? Are they sensitive to that issue, and can AI help there?
Well, I think you said it well, Prem. They absolutely are. And there is a great opportunity for these solutions to be able to help, but trust is very much at the center of that, as you said, and being able to thoughtfully deploy these things and test them and understand the entire care continuum, what those interactions look like, boots on the ground in the room with the patient, how are those conversations going? How are we validating those things and ensuring that every individual is taken along for that journey to understand and validate that that technology is supporting and elevating their work so that they can work at the top of their license and not diminishing or falsifying or hallucinating. And that's really where we need to have the most oversight and focus on quality within care.
Yeah, I totally feel the same as you that the physician fatigue can definitely be reduced with AI as long as we can build trust in the physician as well as the system, the providers, the healthcare providers. But I think that can be achieved because AI is maliciously described as hallucinating, but that can be controlled and managed. Let's talk a little bit about the enterprise level issues of deployment of AI in the healthcare system. What is the conversation happening at the board level of providers and health systems? And what is the conversation happening in the technology development side or the CISO and the heads of engineering in terms of deploying engineering? Are there a lot of people walking around with red flags saying, don't, or there are people walking around saying, yes, 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 and more and more?
We're really at an interesting phase with the technology itself. And because of that, we've got opinions across organizations that vary extremely widely in terms of embracing and deploying and wanting to manage the risk and understand what that looks like within the organization, as well as external risks to data and infrastructure, patient data being the most critical asset that these organizations have and need to protect it. So I will speak from what I believe to be the right posture in this era at the board level and at the executive level within the technology organizations, which is a firm understanding and education on the evolving technology, the opportunities as well as the risks, putting governance in place that's more than just process documents and paperwork, but's real living, actionable task forces and people engaging to have these conversations at the board level, at the executive level, within the industry to be well educated and make decisions based on that. And then at the technology deployment level, having a very strong understanding of both the organization's business, the patients, and the business transformation, the change management piece. Deploying AI to support people is a people first initiative, and being able to do that in a meaningful, effective way needs to put the person at the center of that deployment and that design.
Do you think in your interactions Do you see the boards qualified or up to speed with AI, or also they are also drinking from the fire hose that the rest of us are also? And do you find yourself providing guidance and consulting with them with your deep knowledge?
I think that we're at a phase where we all very much feel we're drinking from the fire hose of knowledge and
Yeah,
the
right.
constant evolution of the technology. And I don't think that's a bad thing.
No.
Where I see both opportunities as well as a really healthy embrace of what's new at the board level is boards understanding when they don't know what they need to know to make the right decisions for the business, and bringing in experts to be able to advise and educate so that there's the context so that everyone can have a conversation coming from the same page. Because I think that is one of the biggest challenges we saw early on and will continue to see is at a certain point when the conversations progressed, no one wants to raise their hand and say, wait a minute, I
Yeah.
don't know where we've gone with this, and I don't have the right level of understanding to make this decision. And so bringing everyone along for that and bringing the education into the boardroom has been really mission critical. And I think, each organization is at a bit different point in that journey, but the ones that are leading the pack and where boards need to be going is bringing.
So in that sense, if we were to lay out sort of like the markers for AI, and you think AI has already entered what's the maturity of AI in healthcare? And then what do you think are the markers, say, for the next 3 years and 5 years and maybe 10 years?
So, one of the things that I am the most excited about right now in terms of seeing AI really being deployed in healthcare is in the rural healthcare space. We are seeing some incredible solutions that are already out in the field. One being a government funded project with the University of Michigan, where there are actually vans being deployed into rural communities with a mixture of a clinic and a hospital setting inside, and a generalist who is able to connect in to multiple specialists and bring that specialty care into those communities, not only with the interactions being much more compressed to access such deep level of care, but also with being able to get into communities that wouldn't otherwise be able to potentially travel to get those interactions. And we're seeing it in multiple places. Trinity Health in North Dakota is also deploying a nurse occupied van out into with a connection into medical centers. And so the nurses, the eyes and ears and hands examining those patients, and they're able to deploy those medical center expertise into the communities,
Yeah,
which
and the
is
medical centers
incredible.
could be not even in North Dakota. They could be anywhere in the world, and they could get the advice and all that. So there's a lot of change that is going to happen on how business gets conducted. But if that ends up being more availability in the rural areas, less travel for the patients, and so on and so forth, maybe even doctors would see the benefit of that. They can do telemedicine, which they do now, but there could be AI assisted ways of doing that. So yeah, I agree with you. I think that's a near-term opportunity. And then I think, what do you think in 5 years we are going to see in terms of how hospitals are run and how drugs are delivered and all that stuff? I mean, it's a leading question. You know what I mean? Yeah.
The future I really see is one designed around continuity of care and guiding a patient through
Yes.
the care continuum. So,
Right.
one thing is true now and will be true, I believe, for the duration of care experiences, which is that when you are coming into a doctor or a specialty, you may not be feeling your best. You're probably at one of the more vulnerable times in your
Yes.
life.
Yes.
And the interactions that you're having in those moments, you're going to remember for a very long time. You'll probably remember the people who helped you in those moments for the
Yes.
rest of your life.
Yes. Yes. Yeah.
And when you're there, where I believe we're headed and have the potential to go in the next 5+ years is the continuity of coming into a care delivery situation, having that triage feel lightweight to the patient, not having to fill out those forms that they've filled out every single time they've come in, but to have all that information already at their fingertips, that they're able to go through and have their weight and vitals all taken seamlessly, and have the physician come into the room and be able to sit down, look them in the eye, make that human connection, and really
Yes.
listen to understand where they've been, where they're going, and how they can really help them. And all of those pieces of where they're navigating to capturing the meaningful notes, all of the continuity of the various prescriptions across multiple specialties that they may have, is all at that doctor's fingertips when they're having that conversation. And the person doesn't have to repeat themselves. They can verify, and they're having an experience where they feel really seen and have the opportunity to be helped much sooner.
Yeah. Right. Well, I've heard in talking to doctors in trying to solve that one problem I had mentioned earlier with the patient doctor interaction. There are tools they have available today, but they don't have something, for example, AI could easily do is give them a summary of the forthcoming meeting very quickly from the
Mhm.
previous notes. It could even talk about the medications they're taking and caution them, if you will, and saying, I noticed in the notes you mentioned that you would give them this medicine, but this could have counterindications like this. And the doctor can say, I understand, but I have to overlook that for this reason or that reason. But there are, I mean, AI is amazing at helping you and me. And so it is only going to be vastly useful for professionals in customer facing activity. And I call patient facing as customer facing activities. And I think if only my wish is, and I hope is that at the end, we don't reduce the number of doctors. We can reduce the cost on the back end, but that we can produce more doctors. Because I think the country, United States, needs more doctors, and doctors are being discouraged from becoming doctors because of the amount of workload put on them. Not because they don't generally love being doctors. I think many of them are made that way. They'll do it anyway. But I think that many of them are leaving early in their 50s. They say, I'm done. I paid my bills off. I made okay, but I don't like the pressure. I hope that AI can be cognitive of that issue and allow for doctors to stay longer in their profession, encourage others to join the profession, because we need doctors in this country, and rural outreach and all these things are very important. And so I agree with you that I feel that AI could, I mean, it could be asked that while I just said that we could use more doctors, and you said the nurse assisted van that goes out, it could be a time when you could say that in certain circumstances, we are talking about AI assisted doctor or a AI first healthcare, which is even an bot or an android that collects that data, and in some respects. So what do you think? Is that being talked about, or they go, oh, no, 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 we're not going to do that kind of stuff?
That's interesting. I see healthcare as being a person to person care delivery model
Yeah.
as long as I can imagine into the future. I think we've talked about some really incredible ways to deploy AI to support and elevate the care structure and the care delivery
Yeah.
experience, as
Yeah.
well as the continuity. But that person to person interaction and the judgment and care that a physician brings to their patient is something that I believe is always going to be an integral part of care. With that being said, I've been part of conversations with some early stage companies who have some incredibly innovative ideas around
Yes.
how AI can be integrated on the front end of care. And I think it's exciting to think about the future, but at the same time, I don't think that's where we're headed anytime
Yeah.
soon,
Well,
because people's
yeah.
welfare and
Right.
health is the central.
Right, right, right. I'll come to that in a second with an anecdotal description I'll give you in a second about that. But I think that what do you think are the hurdles that the industry has to overcome to satisfy the needs, demands of the healthcare industry with AI?
I think it's really a continuity question at the end of the day. Right now, when you look across the care continuum, if you're looking from a patient's seat, you are trying to get your insurance information and your prior authorization before you go into a specialist, and potentially it doesn't come through that morning and you may have to reschedule your appointment, or you're carrying prescriptions from your mail order to your pharmacy across the street and maybe your specialty pharmacy at your hospital, and you're not necessarily all seeing them together. You're having to remind people that, "Oh, I'm also on this." Is there going to be an interaction? And as we've talked about, the care delivery is so overburdened, and I think that's really a result of systems being built on top of each
Like a
other.
low hanging opportunity to just clean up that.
I think it's a very foundational opportunity to step back and design beyond one component of care, whether that's the payer, provider, wraparound health services, or upstream personal care. And it's really looking at those holistically, having a common thread where those parts of the industry are working together in unison, focused on that patient experience to seamlessly pass that data, house that data, give the information at the moment that it's needed, validate that that information is truly accurate and correct, and document those things all the way through the process and make sure they're passed to the right place. And that's a whole industry coming together to really create that solution. That is not a subset or a bifurcated model of one organization working by themselves.
Yeah, yeah, I agree. I mean, would say that AI, the hurdles for AI in healthcare industry would be data privacy issues. I see no reason why that cannot be addressed at scale. Data exfiltration and patient data privacy issues, been done before. It can be done in the AI world. The difference in AI is that you have this notion of prompt injection and AI agents that can infiltrate and discover information in ways different than previous workflows that we used to have or have now. So, but trust would be one area I can clearly see that. I see that look, the efficiencies in the back end of the process are happening and will continue to happen, and AI will make that even more efficient. And I think some of that burden is shifting towards the doctors, but I think we can reduce the burden on the doctors by see, doctors are very intelligent people, and they don't want to be treated like robots or some machine is better than them. They don't mind the assistance and all that, but I think that is where I think the rub is going to be for AI, is that, or the industry that provides that to the doctors, is that create more doctors, respect them. Some doctors will take less money for less work. Let's face it, they would love to see go home and watch their daughter's soccer game or the son's basketball game, which they haven't done for years. And some of them talk about pajama time, which is at night time. They have to do all that recording of the information. So I think those are hurdles that are just around the corner. They'll be overcome as long as the powers to be, whether it's governance or it is whoever controls the purse strings of this industry, accepts that it is possible to reduce cost for healthcare in America. I think that would be a real great outcome if we can reduce healthcare costs and increase the number of doctors and outreach. I mean, you have any experience of that or conversation about that or thoughts on that?
Yeah, Prem, I agree with you that we need more doctors and more nurses, and bringing AI into the equation, it only expands our need for care delivery. And what we need is more access and more
Yeah.
equitable care across
Yeah.
communities. And that's where AI is going to allow us to extend that care and high quality interaction, meaningful care in the right places and bring that into communities that don't otherwise have that. And I think that is very much central to the conversation. It's around the interoperability, the ability to build these systems so that they're scalable and they're doing those things and they're being deployed in the ways that are going to create lower cost care that's higher quality. And it's really driving those two things, which is where I see the biggest opportunity in AI today.
Lauren, do you track or deal with international healthcare providers or systems? And do you know where internationally the advanced countries are or the developing countries are with the use of AI technology in healthcare?
You know, a lion's share of my work is really focused around US healthcare. However, I do have the opportunity to be part of conversations and forums internationally where we're bringing our ideas together. So I can speak to some of those conversations at a higher level, which I will say, I think a lot of the challenges that we talk about so prevalently in the US are not so far removed from many other countries in terms of access, in terms of cost, even in the government funded
Mhm. Yeah.
countries. It's very segmented in terms of that capability and access to care and what that looks like. And there is an excitement about the infusion of what AI can bring and what technology can bring in terms of building lower cost hospitals and bringing that innovation in to create medical devices that we don't otherwise have access to. And I think that's a international and US conversation. And the more that we can share ideas with each other and drive those initiatives forward, the faster we're going to be able to accelerate
Right,
care.
right. Agreed. And I think that one of the areas we didn't touch on, but we should now, is the area of AI in healthcare related to diagnosis and treatment, and the amount of data that can be processed by AI driven machines for cancer research, which is you're advising a company in cancer. So I'm sure you can't, I don't know how much you can tell us, but I mean, there's got to be a lot of AI used in figuring out early detection signs of cancer, right?
There is, and while I can't speak to the specifics of the organization that I advise, what I will say is there's been some very exciting breakthroughs in terms of both research as well as the pace of being able to read X-rays, ultrasounds, applying AI to medical devices is a huge opportunity for us. But at the same time, on the other side of the coin, as we've talked about proceeding with caution and proceeding with quality first, if we're looking at that with eyes of a licensed physician and
Yeah.
evaluating, it's being dropped off, it's set to a sensitivity rating that there's probably going to be more false positives than not. And we're getting more people to look at it. That's when we're seeing much higher early detection
Yes.
numbers. That's when we're seeing those volumes go
Learning.
up.
Yeah.
It's the support
Yeah.
system.
Right. 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 Well, I think we could be close to wrapping this up, but what is your view of AI per se and the industry, or what would you like to say that I have left uncovered in this discussion? Because this is not certainly the last time we're going to have this conversation, Lauren.
Well, Prem, thank you so much for having me
You're
today.
welcome.
I've enjoyed this conversation so much, and I agree. I think we're going to have many reasons to be having this again soon. And it's changing so constantly. The advancements in AI, in what it means in healthcare, where we can apply it. I am deeply energized by thinking about the future of care with these systems applied in a thoughtful, meaningful, patient first way. And I'm energized by the idea that we can reach across organizations and work together to create a healthcare system nationally and across the world that
Yeah.
brings care to more people in a more equitable way. And that's what I'm working toward every day.
Yeah, yeah, absolutely. And if I were to just close on this point, would be that is AI curing healthcare or entangling us even further deeper into a mess? I think no, it is helping healthcare. And the future I see, as a technologist, say 10 years out, would be that inevitably we will see androids or droids walking the hallways of hospitals, not doing some of the repetitive work, maybe even going into a room and walking in with a tablet and asking all the questions before the doctor comes in, or taking notes while the doctor is examining, and freeing up the nurses. One could say reducing the number of nurse assistants, but freeing them up for other things. There could be situations where androids could be used in very difficult health conditions where you would be afraid of being contaminated yourself, or the amount of effort it takes to reduce exposure to contamination, Ebola, and things like that. I think that could be an area where androids could be very helpful, and harsh environments, so to speak. And I think that further out, I have a feeling that in one sense or the other, you and I each will have our own AI twin. So anyway, Lauren, thank you so much. On that note, I thank you again, and certainly it's not going to be the last time we'll be talking.
Prem, thank you for having me. I've so enjoyed having this conversation with you.
You're welcome.